the MS Michigan Man 64 podcast. My name is Brian Wallace, and I am the MS Michigan Man 64. The MS Michigan Man 64 podcast is about chronic disease awareness. I have had multiple sclerosis for the last 27 years. It's an invisible chronic disease that I've been battling for half of my life. I want to share with you what it is like living with the chronic disease from my experiences and the experiences of other chronic disease warriors. We can fight to have a voice to those that want to listen. Together, we can motivate and educate. Hi, welcome to the MS Michigan Man 64 podcast. So today I am sitting down with my chiropractor. His name is Dr Haely. I found him about a year ago, and I actually had a mixed feelings about chiropractors. I had seen two in my prior experience of dealing with pain, and but when I found Dr. Haely, he was referred to me by a lady named Maria. She was episode 3. She has primary progressive. But, you know, he did real good things with Maria, and I just wanted to bring him on to kind of explain the chiropractic field, a lot of things that I didn't understand about it, and I want him to kind of clarify it so that you guys all have an understanding about it too. But welcome, Dr. Haely. How you doing, Doc?
I'm doing great. Thank you so much for inviting me.
Yeah, not a problem. I'm glad to have you on because I think that you have a lot of valuable information and techniques about trying to manage some of the pain that goes with the multiple sclerosis diagnosis. So kind of give me an explanation about your field of chiropractic that you practice. I know it's called Gonstead. And I didn't even really understand what that all was. And I did a little bit of Googling and research after I met you. But can you kind of explain that whole chiropractic theory that you practice?
Sure. I went to a school in Atlanta called Life University. And, let me just go back to my experience. The reason why I'm a chiropractor is I wouldn't be able to practice physically if it wasn't for my chiropractic experiences. Mm-hmm. As a child, I was about 12 when I had my first experience, and I went to this. I was playing baseball, and ended up sliding into second base, and I couldn't get up. It felt like two people had their heels dug into my kidneys, and I had spasms and pain, and I was really scared. Mm-hmm. We did the medical route. We did painkillers, muscle relaxers, anti-inflammatories. They said it would get better on its own. 4 days later, I was still crawling to the bathroom. Wow. And I was not able to get weight bearing without like 9 out of 10 pain. Yeah. So my dad came in from out of town. He says, "Hey, you need to see my back doctor." And so I go to this chiropractor, and he did an exam, and he said, "I can help you." And he gave me my first adjustment. He took some x-rays, did an exam, and I felt a little bit better right away, probably 20% better. I could actually get in the car a little bit easier than I got out. Okay. So after a little while, I ended up, I saw him maybe 6 or 8 times, and I was about 85, 90% better. And I was really excited about what he did. And he had a sit down with me after a re-examination. He said, do you have any questions? And I said, yeah. I said, what'd you do to my intestines? Okay. He said, what do you mean? I said, well, I'm having a bowel movement about every other day now. And he says, that's horrible. You should be going every day.
Yeah.
I said, but you don't understand. Before I started seeing you, I was going once a week.
Oh, wow.
And he says, oh, yeah. And that was a normal occurrence for me.
Yeah.
I just thought I was like my mom, it was a genetic thing, this constipation thing.
Yeah.
And I said, so explain to me how you're changing that. I don't get how, manipulating my back or giving me an adjustment is helping this.
Mm-hmm.
And he said, the nerves that come out of your low back, they go into your low back muscles. That's why you had those spasms. But they also control and coordinate your legs. They control and coordinate your bowel and your bladder. And he said, if you just had a small section of your intestine that was paralyzed or semi-paralyzed, weakened by pressure on a nerve,
Mm-hmm.
That can slow down your elimination process. And I was like, wow, you're unparalyzing my bowels. And he says, yeah.
Yeah.
So he said, so he goes, but we're not done until we get you going every day. Well, I can tell you now, I go every day.
Wow.
And I didn't change anything. I was 12 years old. I wasn't going to change my diet. I wasn't going to drink more water or whatever. It was for that particular case, it was caused by nerve interference. So I thought that was really cool.
Mm-hmm.
Then I asked him, what does it take to become a chiropractor? And he says, well, you got to study, your sciences through high school, and then you go into college, and then you get a 4-year degree in biology or physiology or something in the pre-med field.
Mm-hmm.
And then you go another 4 years to chiropractic school. And he goes, and then you can help people like I'm helping you. And I said, oh boy.
Yeah.
My parents, my mom was a high school graduate. My dad was a high school graduate. He went to Kent State for 1 semester and found out that their honeymoon was very productive. My oldest brother was conceived, so he had to drop out of college and work.
Yeah.
But anyway, I thought the 8 years of school was way too much for me.
Yeah.
And so I ended up going to a small school, private school here in Ohio Northern. And I got a dual degree in finance and marketing. And long story short, I was a collegiate wrestler. I was an athlete like you.
Mm-hmm.
And I was involved in a pretty good match, and we hit heads. And I ended up getting some shooting pain down my neck into my right arm. And long story short, it led to later on finding out that I had avulsion fractures of my C5 and C7 in my neck.
Wow.
But that, it was scary because I started to, not only was the pain severe going down my right arm,
Mm-hmm.
into my fingers, it started causing weakness in my right hand. And before I knew it, I started seeing the doctors, and they were giving me anti-inflammatories, and they were trying to treat the pain. And it wasn't helping. It was getting worse. I couldn't sleep. I couldn't do anything. It was hard to even raise my head up.
Yeah.
Because that would increase the pain down my arm. And long story short, I went to a neurologist, and they said, yes, you have some nerve damage. After they did a very painful nerve conduction test. You may know what that's like.
Yeah, I've had that before.
Yeah, it's not a fun test.
No, not at all.
I left that appointment being very angry because they weren't going to do surgery. They said it's away from my spinal cord. The fracture was. They said the fracture had healed. And I said, well, why am I still having this problem? And they said, you have some nerve damage. Mm-hmm. And I said, well, where do we go from here? They said, well, we're going to keep you on the anti-inflammatories and see how you do. You're young. You should be able to heal from this.
Yeah.
And when I heard that the fracture was fixed, I thought of nothing but going back to my chiropractor. So I went back to him and I said, can you do something about this pinched nerve?
Yeah.
He says, I sure can. And in a very short period of time, in terms of healing, I'd say probably within 6 weeks, 4 to 6 weeks, I was getting my strength back because I had lost about 70% of the strength in my arm.
Oh, wow.
Yeah, I was thinking my whole life had been changed by that wrestling match, and
Yeah.
and so this guy started working on me, and it was comfortable. It was something that he was able to gradually get the pressure off that nerve and heal this hand, and so much so that I said, hey, if I want to go for my senior year, I was an academic All-American in my sophomore year, and I missed my whole junior year. And I really felt, back when you're young, you think you know what's important.
Yeah. Right.
If I knew now what I knew then, I wouldn't have gone back to wrestling. But he gave me the green light, and I went back, and I was a two-time academic All-American at Ohio Northern.
Awesome.
So it was, I was so drawn to this profession that I think that was my second calling.
Yeah.
But I was already, I was dual majoring in finance and marketing. I ended up going to work for 6 years. But I started having low back problems during my work as I sat more and more and more in the car. And so I found myself going to a chiropractor again.
Okay.
And that's when I said, I want to change my profession. So I went to night school for about 2.5 years, and then went to Atlanta, Georgia to finish my chiropractic degree. So, but when I went to school there, and we were talking about the types of chiropractic, I had no idea that there were so many different philosophies and so many different ways of approaching chiropractic. I thought that they taught them all the same things. They just applied it differently according to the patient.
Yeah, that's what
and
I thought
that
too.
was oh my gosh, I was completely blown away. I was so confused when I went to school when they had all these clubs, and these clubs were study clubs for these different techniques. And one of them is the one that I am proficient in, and it's been named after Dr. Gonstead. But I didn't start with that. I started, asking a bunch of questions. What is this all about?
Yeah.
And very confusing for the general public.
Yeah.
In Ohio, there's, as far as I know, I think there's 23 forms of chiropractic acceptable in the state of Ohio. And there are some people doing chiropractic that are not acceptable in the state of Ohio, but they're doing it anyway. Yeah. And so that's, it is very confusing.
Yeah.
So I started attaching myself to some of these gurus and saying, hey, my low back is really giving me trouble. It's not getting better. Some people are treating the pain temporarily, but it's not getting any correction. Mm-hmm. That's long lasting. And I feel like I'm getting worse and worse overall. And so I gave 3 different types of chiropractors a chance to work on me. And they had an interesting approach. I learned a lot, but they seemed to have holes in their philosophy and holes in how they approached the problem, and they were stumped with me, and they couldn't fix me, so I moved on.
Okay.
So I ran, my next door neighbor was, believe it or not, his former profession was a rocket scientist. He was in jet propulsion for I believe it was NASA. Mm-hmm. And he wanted to change his profession to go into chiropractic. And he was an older student like I was. And I kind of attached myself to him. And he was a person who was an SI, and he was a student who was able to, in the clinic, he wore a blue coat or a white coat, and he was able to sign off on other people's visits with patients. And he was able to do that because he took an extensive test and was basically a clinic doctor in the clinic, able to help people with all these different techniques that they were teaching at this school.
Mm-hmm.
And he had to be proficient at all of them. And I said, which one do you think is the best one, or do you think it's better to just kind of mix them all up like the president of the school says? And he says, no. He goes, this Gonstead thing is what I'm going to do when I get out of school. I'm going to do that exclusively, because when you study it in depth, there's not a hole in its philosophy, not a hole in it, the way they approach what we call the vertebral subluxation complex.
Mm-hmm.
He said, biomechanically, they do everything correctly. It's safe, and it's so effective for your patients. And I said, well, I need to learn more about this. What should I do? Because there's only a few classes that taught it, and it was just skimming the surface, really, of how deep this methodology is.
Mm-hmm.
And he said, come to our study club. And they would do classes, and they would do hands-on teaching, technique. And then they had advanced classes for advanced cases, such as MS or other types of cases.
Yeah.
How do you handle those? How are they different from other cases? And what are the pitfalls or the things that you have to look for? So I started studying this, and but more importantly, I attached myself to the doctor who oversaw the study club. You had to have a doctor that would sponsor your club. And there was a lady who gave up her physical therapy profession for chiropractic because she had a health condition that led to suffering, and the only one who could help her was a Gonstead chiropractor, and that's how she got into Gonstead and how she went back to school and became a practicing chiropractor part-time and a full-time chiropractic professor at the school. Mm-hmm. Well, her part-time, she would take patients, and I said, can you see me? And she said, sure. And she did this analysis of my x-rays unlike anyone else had. Her attention to detail and her specificity was different, and she was just so articulate and so bright. I just admired her so much. Dr. Linda Mullen, thank you for your influence on my career. But she was able to start working on me, and I was getting results very quickly in comparison to these other guys that I was seeing for months and getting just very minimal improvement.
Yeah.
And she said, no, we should correct this. And she also got into my ergonomics. She said, what are you doing? Because I would come to her and I said, I felt great for about 2 days, and then it slid backward. What's going on? And she said, what are you doing at night before you go to bed? I said, well, I either sit at my desk and study, or I sit with my wife and we watch some TV. And she goes, where do you sit? I said, well, I sit on this really nice recliner. I spent a lot of money on this. And she goes, up with your feet up? And I said, yes. And she says, you need to get away from that chair. And I said, for how long? And she said, well, why don't you just do it for a couple weeks and let's see how you do. And wouldn't you know it, I got a lot better.
Yeah.
And long story short, I was sold about this, and I got my wife to try it, because she said the chiropractor that we tried back in Columbus, he didn't help her. We spent a lot of money to have her go visit this guy, and he would do the same thing over and over again, expecting different results, and never got the results for her. And within a few short visits with this Dr. Mullen, she got better faster than I did. And she turned to me and she said, stop going to all these other study clubs. You got to go to this Gonstead stuff. So I had her.
So Doc, what exactly is the Gonstead theory of chiropractic? Get into that a little bit.
Yeah. Sure. It's based on Dr. Gonstead. He was a little Norwegian guy in Wisconsin that had a autoimmune disease that affected him. It was RA when he was 19 years old. Mm-hmm. and both his knees swelled up. He was bedridden, and after trying everything medically, nothing helped him. His aunt, who he was staying with when he was going to the University of Wisconsin, said, "Enough's enough. I'm going to call my doctor." And it was a chiropractor, and he saw him every day for 2 weeks. Sometimes he would adjust him, sometimes he'd check him and not adjust him. But he had a full remission of his RA in his knees. He was able to get back to his feet and get on with his life. And he said, "This is a message for me to learn this stuff." So he went to Palmer, learned what they had to teach him, and then he had a scientific mind. He was kind of like more of an engineering type of mind. And he applied more engineering and science to chiropractic than a lot of other people in his profession ever had. His ability to analyze biomechanics of the spine and the pelvis. He was the first one ever to adjust the pelvis in the chiropractic profession, and with osteopathy, because at that time, people thought that the pelvis was a synosmosis joint. What that means is that it used to work, but now it doesn't move. It's just stable. And that is completely wrong. The biomechanics of the pelvis moves in a symmetrical way to take pressure off your hips and off your spine when you move, when you walk. Yeah. Anyway, he started building a huge practice, and the medical professionals in his town, when he moved back to Mount Horeb, Wisconsin, said that they would take 6 months and he'd be out of town in no time because they would take all his patients or whatever. Well, the reverse happened. Both the medical doctors left the town, and he learned that he had to do more than just chiropractic. He had to treat patients for all sorts of problems. Right now, I don't set broken bones, but I'm sure he set some broken bones in his day. But he got a world renown. It started off with just a few doctors that would send their toughest cases to him, and they would get better. And then it grew from there, and it got to the point where doctors are saying, "Hey, rather than us send our worst cases to you and have them coming back feeling better and thinking that we're idiots, why don't you teach us what you're doing, because you're doing something that nobody else is doing." And so that's what started his seminar. And it's based on the thought, the philosophy of the vertebral subluxation complex, and that is you get a trauma, let's say it's a physical trauma, to the spine or to the pelvis, and you get a small misalignment in there. And it's like any kind of sprain or strain that you might get, but you get swelling in the joint. And then because the joint is slightly out of position, you get some dyskinesia, or you get some improper motion in the joint. It doesn't have its full range of motion. So there's some restriction in there as compared to the other joints around it. But what makes it very, very different from every other sprain strain that you can have is its location. So in the spine, it's so close to your spinal cord, so close to your nerve roots that exit the spinal cord. It can be right at your brain stem, because your brain stem can extend down to C3 in your neck, that it can actually put some physical pressure on the most sensitive part of your body to pressure, and that is your nerve system. So the weight of a dime pressing on a nerve can decrease function of that nerve up to 40%.
Wow.
And anything it controls, and your nervous system controls and coordinates everything in your body. You are declared dead when you don't have an electrical impulse coming out of your brain, which is the generator of these electrical impulses. And these impulses they serve two purposes. They serve as electrical lines. So they give actual electricity to your body to make your muscles contract and to make your stomach digest. But it also gives instructions to those areas of your body. It controls those hormones that can get out of whack for people. It controls everything. In fact, in the last hour, you've had over 10,000 activities in your body to keep you alive. And it's all coordinated by that brain that extends through the spinal cord out to the nerves and then to every part of your body. So these vertebral subluxation complexes, they put pressure on the nervous system, and just a little bit of nervous system pressure can cause dysfunction. It can cause muscle tightness, muscle spasm, muscle weakness, even muscle paralysis. But it can also do that to organs, like I talked about with the intestine, or it can increase your heart rate or decrease your heart rate. It can cause you to be susceptible to disease and different infections. I get a lot of patients that come in to see me for chronic ear infections, let's say, or chronic sinus infections. And so it can go across the board when it comes to your health. More specifically, when it comes to how they address it. So Dr. Gonstead had an exam that he would do, and he would test these different things. Like we use, what makes us a little bit more unique is Gonstead specialists use a scope, and the scope is a thermography scope.
Yeah, you use that on me.
You put it, it has dual probes, and it rolls down your spine. It measures the temperature of your skin. So why do we do that? Because your largest organ in your body is your skin. And dysfunction can show on the surface of the skin as there's temperature differentials from right to left on the same level of the spine. So if you had, let's say, at C6 in your neck, you had the right side of your spine was half a degree hotter on the right than on the left, then there could be a nerve that's causing that. So we have to investigate further. So the exam does go further into palpation, and we do a static palpation where we look for little pockets of inflammation near and around the spine. And oftentimes a small little, let's call it a bruise, like you would feel on a peach that has a bruise. If you closed your eyes and I gave you a peach with a bruise on it, you could probably feel it. You could probably find it.
Right.
That's what we do with the spine. But then we also want to look for dysfunction in the joint. So we put you through a range of motion in that joint. We want to find if there is dyskinesia or that restriction in the joint motion. And then because you can get a compensation, and this is something that is also very different from other forms of chiropractic that don't acknowledge that you can have compensations in the spine for a restricted range of motion. You can get hypermobility and instability in other joints as a response to this joint that is stuck. So above and below might be sore and tender to touch, but it is moving too much. And if that is manipulated, you can get worse.
Got it.
So to be very specific and precise about how we address it is just drilled into us every time you talk about Gonstead, because there are other forms of chiropractic, and I went to one and I had no idea that it was so much different. But the guy did a manipulation to everybody the same. If you watched him, because I wanted to watch to see how he practiced, it was really boring. He'd put a person on a flat bench. He'd look at their leg lengths, and there's a problem with that, and I can explain that to you in a moment. But there's in Gonstead, we don't use leg lengths to see or to find subluxation. But then he would put me on my side and crack my left hip, very non-specifically, by the way. He wouldn't use x-rays. he would just go ahead and crack the hip in any direction. And then he would flip me over on the other side, and he'd put me on my left side and crack my right hip. And very, he didn't care where he put his hand. He just put it in there and got it to move. Mm-hmm. And then he would put me on my stomach and crunch about 3 or 4 areas of my mid back. And then he'd lay me on my back and twist my head to the right and twist my head to the left, and make everything mobilize. And we call that popping and praying. Mm-hmm. That he's just hypermobilizing everything, and the easy ones twice. And it's very non-specific mobilization. And in my opinion, it's not very good.
Yeah.
Because, what do you know that isn't better when it's more specific and precise?
Yeah.
We can move, in Gonstead, we can move one bone and leave the others unmoved, untouched, unharmed. Above all else, do no harm. That is something that chiropractors believe in, and that's also what medicine believes in. And unfortunately, that's something that isn't followed all the time.
And I can relate to what you're saying, because I've had 2 other experiences with chiropractors. One went good, one went bad. But there's a fear almost of people going to chiropractors, because I'm 54. Yeah. I'm 54 years old, and I just started going to see you a year ago, and I was still very reluctant to see you. But since I have gone to see you, my eyes have opened up about chiropractic. With me having MS, I struggle walking, and going in and getting adjustments by you, it relieves some of that pressure that I do feel from the multiple sclerosis, and it makes me feel better. I wouldn't have believed it if you would have asked me that 5 years ago, but I'm a believer now in it.
Well, yeah. It's great to hear that. Dr. Gonstead treated a lot of people with MS, mm-hmm. and he got a lot of people much better. Or he had a lot of people that went into full remission if he got to them quickly enough. Yeah. The early diagnosis is so important, not only in medicine, but in chiropractic. Mm-hmm. It's so important to get addressed early, because permanent damage can take place from this vertebral subluxation complex. Mm-hmm. If you have a joint that's not functioning properly for a period of time, let's make an analogy. If you're driving a car with the front end misaligned long enough, you're going to wear down one tire 5 times, 8 times as fast as the other 3 tires.
Right.
Well, that happens in your joints.
Right.
And that can accelerate osteoarthritis. Now, I talked about an autoimmune with rheumatoid arthritis. That's a whole other animal, like MS, where your body's attacking itself. Which could be caused partially or fully by your body's inability to determine what the problem is in your body. Yeah. In terms of an autoimmune, you're attacking, your body attacks itself. Yeah. Why is it doing that? Right. There's dysfunction in the communication from the brain to the body and the body back to the brain, and your immune system is attacking itself. Right. So, but when it comes to chiropractic and safety, for instance, if you really study and become a biomechanics expert, you would not twist the spine. It is not good for the spine to be twisted. Mm-hmm. Even when I put you on your side and we adjust your low back, the main thrust is from back to front. Yeah. I kind of my focus is not to rotate or twist, and you're the fear that you're talking about. When you see a person on the internet who takes a towel on someone's head when they're laying on their back and just distracts it and pulls it up towards their skull, towards the top part of their skull, and they talk about their whole spine like lengthening and having this huge sound and all these vertebrae going off, I get angry when I see it. Because that is not taught in schools. when that guy on the internet does harm for someone, I'll be in the front line saying, let's take away his license, let's put him in jail, because that is not safe.
Yeah.
And one of these days he's got to hurt somebody.
Yeah.
And you're not going to see it on the internet. You may not even hear about it. You might just see him go away.
Yeah.
But
so
these manipulations are not as safe as a front to back adjustment, because when you see, I wish I had a visual that I could show people, but the joints interlock where the top one goes on top of the lower one, but it can go backward. And when it goes backward, there is some rotation that can take place, but the main misalignment is front to back. So if that isn't addressed, you can't take the pressure off the nerve the way it needs to be and restore proper function.
So
so it's not as safe in some cases, because there is a small percentage of people that can have strokes from rotational movements.
Mm-hmm.
When I was in school, there was a young woman who had a stroke, and she didn't have a predisposition in terms of, she was older. She had, she had a lot of cholesterol built up in her vertebral arteries. She had another young friend of hers who was not very trained, and they were doing a rotational twisting type motion that is not Gonstead, that led to her stroke.
Wow.
And now the statistics are 1 in 1.3 million and 1 in 3.1 million. But I can tell you there were some studies done in Australia. There's a lot of Gonstead people in Australia. And their studies show that when you adjust the spine properly, the risk of stroke is almost nil.
So, Doc, if somebody is, looking for some kind of relief, whether it be they have MS or they have some other kind of issue going on, and they want to look into going and seeing a chiropractor, and they're trying to find one that practices Gonstead, how do they even do that? Because I wouldn't know how to do that.
Yeah, and what's even more difficult is that some people list Gonstead as a list of things that they do. If you truly do Gonstead, that's all that you do.
Okay.
It's a from A to Z methodology of the way we take x-rays, the way we analyze a patient's spine, the way we analyze their x-rays, the way we deliver an adjustment is all different than a generalized manipulation. But because there's confusion even in my profession about, truly what is Gonstead, many of the chiropractic schools don't even teach Gonstead, which is a shame. I think it's an atrocity, but they have a different philosophy, or they have no philosophy. Philosophy is the answer of why you do what you do. And it's so important to have that. I mean, you have to know why you're doing what you're doing, or why you do it at all.
All right.
But unfortunately, there are a lot of schools that don't even teach the philosophy of chiropractic, that the body is built to heal itself, that the body has power to heal itself. But if you have disruption in the spine or in the nervous system, if you have a brownout to the nerves that go to your stomach, are you going to be able to digest well? No.
Right.
So the guy 2 weeks ago that said, I haven't had heartburn in 3 weeks since you adjusted my T6. I feel so much better. There's a reason for that.
Yeah.
But if you don't even believe that the nervous system can have that effect on a person's health, you certainly aren't going to do a specific adjustment that's going to help alleviate that or help it heal itself.
Yeah.
But the first thing you can do is get on a website. There's 2 websites out there. One is called GonsteadSeminar.com, and another one is called Gonstead.com.
Okay.
And there is a list of people around the country that are more specific, more precise, that use a scope, that use x-ray. I would never, ever go to a chiropractor. I drive 40 minutes to see my chiropractor who's, that far away, one direction. And I pass dozens of other chiropractors because he does the type of work that I do, and I can trust that it's safe and it's healthy and it works every time he does it for me. But so GonsteadSeminar.com, Gonstead.com, they have a list of people who are professional and who can help you. If there's a diplomate in GonsteadSeminar.com or a fellow is the highest rating you can get on GonsteadSeminar.com. That's a person who's very experienced and is excellent. But I would say any of those people that are on those lists are great. Diplomates, and then just the people who are just regularly, on those websites. They try to monitor the people. Most of those people on those websites are there because they actually do the system and do it correctly. There are a few that might get on there that if they don't use a scope on your spine, if they do use the 4 pieces of equipment that we have 4 benches that we use for different body types, for different types of conditions, for different spinal alignments that we see on the x-ray, or misalignments, I should say. So those are all tools that we use to be as specific and precise to get the best results possible. Dr. Gonstead said when he treated MS patients, he said, if I can get to them before they go into a wheelchair, I can keep them from getting into a wheelchair.
So,
and that was powerful. That's powerful information. But just generalized, cracking and praying is not going to get that done. It has to be specific. And he found that most MS patients suffered trauma near their tailbone, in their very low back. And if you think about it, you have a spinal cord that attaches from your brain all the way down to the tip of your tailbone. And you have cerebral spinal fluid that flows from your brain all the way down to your tailbone. And when you walk, it pumps that cerebral spinal fluid. And that cerebral spinal fluid can be disrupted. That motion, that lotion that kind of, lubricates the nervous system and cushions it, can be disrupted by tension from a trauma to the tailbone and the nervous system. And your sciatic nerve goes from your low back all the way to your legs. It can cause weakness. It can cause drop foot, like in Maria's case.
Or use me.
And,
you can use me, Doc. You use my MS.
Yeah.
Talk about my MS and my X-rays and all that. You can use my.
Well, you've had, if I recall properly, you've had it for almost 30 years, correct?
Yep, 27.
MS.
Yep.
Yeah. And so then you combine the trauma, the multiple traumas that you've had playing big time football at the University of Michigan.
Mm-hmm.
Now, it's bad enough for a high school player to get beat up a little bit, but you go against the best athletes in the world, and they are. Their goal isn't nice towards your body,
right.
And so you get these multiple traumas. In Maria's case, she had a birth. Now, how many women out there have given birth and have had back pain after birth, or have had pelvis pain, or have had their tailbone dislocated during the birth process?
Yeah.
Dr. Gonstead said that he thought that more MS patients were in the north because they slipped and fell on the ice and fell right on their tailbone and did trauma directly to their tailbone and affected their nervous system in such a violent way.
Yeah.
And so that is, but the longer you have vertebral subluxation, the longer you have MS, the more degeneration occurs, the more permanent damage occurs. So getting to it quicker and sooner is so important.
Mm-hmm.
When I first met Maria, I was concerned that her drop foot could be permanent because of how long she had the drop foot.
Yeah, and Maria actually was diagnosed with primary progressive too. I mean, I was relapse remit, so she was diagnosed with something a little bit worse than mine. Yeah, and
well, I've had the the opportunity to work with dozens of people with MS
mm-hmm.
over my last 24 years of practice, and each person is a little bit different, but
sure.
they're similar in a lot of respects too. And I haven't found one MS patient that didn't have sacral problems or very low back L5
yep.
Or pelvic problems.
Yep.
And many of them, if not all of them, have a history of trauma to that area.
Mm-hmm. I do.
And so, but what's remarkable about Maria, I think, just this year, she has been able to dorsiflect, which is, when you have your foot flat on the floor and you're able to raise your toes and your foot up towards your shin,
mm-hmm.
that is called dorsiflexion. She was unable to do that, when I first saw her, and now she's able to raise it probably about 60%.
Yeah,
and she can raise her toes up. She's doing a remarkable job of healing. And what are we doing? I'm not treating MS. Chiropractors find and locate and correct vertebral subluxation complex, but we do it in a specific way so that it can help healing as it pertains to the patient's symptoms that they come in with. Certainly there are some areas of the spine that can't be adjusted at the same time. Sometimes you have to wait to adjust one area of the spine to have a specific effect on a specific part of your nervous system. Yeah. And so that's what we tried to do. I had one MS patient that you can only adjust one segment on her. If you tried to do more than one, she would like crash for like a week.
Fatigued.
And then she'd slowly get better, and she'd be like, man, that was just a little too much. And so we pared it down and did one specific segment, and she's like, wow, that had a huge effect.
Yeah.
And I've had, over the years, we've had a lot of patients go, basically become asymptomatic because we got to them early enough.
Yeah.
They're like, well, do you think I was misdiagnosed? I was like, well, I don't know if you're misdiagnosed. If you see lesions on your spine, that's the diagnosis for MS.
Yeah.
Or in your brain. But can you get the nervous system to function better? And the answer, probably 99 times out of 100 is yes. But what percentage improvement can you get? And, can you get those muscles to reconnect to the nerve? Can they get the nerve to send those messages properly? That's our goal.
I think it's definitely possible. And I can tell you, I've seen it. And when I saw Maria a year ago, and I talked about her a lot when we did our interview on episode 3. But I met her in 2012, 2013. She had primary progressive, and by the time our kids graduated from high school, she was very dependent on a wheelchair, walker. And when I saw her a year ago get out of her car and she was walking without anything, and I was like, Maria? And, and she told me that she started seeing you, about 6 months before that. And I was just blown away that a lady that was in a wheelchair is out walking around now. And, I'm not saying that you cured her MS, but my God, man, you gave her so much, some kind of a relief that triggered something in her body that got her back up and moving a little bit.
Well, she's still healing. And it takes, consider this, when you cut a nerve, when you cut your skin, those skin cells are very simple. You have a good blood supply to the surface of your skin. Most scrapes and cuts can heal in a week or two. And that's amazing, right?
Mm-hmm.
But nerve cells are the most complicated cells in your body. They are the largest cells in your body. Like one cell, consider this. You have long legs. You have one cell that extends from your low back all the way down to the big toe.
Mm-hmm.
And if you do damage to that large and very complicated cell, how long does that take to heal compared to a skin cell? So the healing process is very a long process. And what we try to do is get people not only do the very specific adjustments to alleviate nerve pressure, but we also talk about nutrition. We talk about exercise. We talk about ergonomics because, I think I heard you too on your podcast talking about sitting a lot.
Yeah.
And ergonomics is huge. If you're not sitting properly, humans were not built to sit for 8 hours a day.
Yeah.
And, we're starting to realize that. We're starting to have standing desks for people. We're starting to have people aware that, hey, I need to get up and move around.
Right.
And these home offices, all my patients, I tell them, you got to get up and move around.
Yeah.
And you have to sit properly to begin with. Has anyone taught you how to sleep properly? Has anyone told you how to support your back properly when you are sitting?
Yeah.
Those things are huge. I had a tailbone injury, and I sit in a very firm chair at night when I'm relaxing with my wife. I do not sit on the couch because if I sit on the couch, I can guarantee you in 20 to 30 minutes, I am not right.
Yeah.
And I have to go visit my chiropractor. I can be ruined in that short period of time.
Yeah.
And if you don't know what's going on, so we try to educate our patients about, try to address these issues along with speeding up your healing with nutrition.
Mm-hmm.
She uses a lot of nutrition. There's a supplement that's called a protomorphogen that I use from Standard Process. It's Neurotrophin PMG. And a protomorphogen kind of acts as a decoy for your immune system. They have a process at Standard Process to extract these PMGs out of the nucleus of certain cells. Let me give you a quick example. If a person has a heart attack, they have damage to their heart, right? Your immune system has certain cells that go in and take out the dead cells that are specific cardiac cells. Well, what we know to be true is that in some individuals and some people, you can get an autoimmune disease to your heart because your immune system doesn't stop at the dead cells. It starts attacking the good cells.
Yeah.
And so then you have damage. So is that the same thing that happens with MS? I think so. I think that's part of it. So can you distract the immune system and get it to attack these PMGs when you take a supplement and you take this protomorphogen? Can that help give your nervous system a chance to do a little bit of healing without being constantly bombarded by your own immune system, constantly, being attacked? I think so. I think it can help. It's multifactorial MSs.
Mm-hmm.
But when you're dealing with the nervous system, you really have to address the biomechanical part of it.
Right.
And that's what we do.
Yeah, I'm sold on chiropractic. Like I said, I don't, I'm not looking for somebody to cure my MS. I know that nobody's going to cure it, but if somebody can help me just function a little bit better, I'm all for that. And that's what I use the chiropractic for, getting the adjustments. Because before I started seeing you, Doc, I mean, I was in a lot of pain, neuropathy in my legs. Now I still have pain now. I know you always ask me what my pain level is, but it's way better now than it was prior to me seeing you. So, I mean, just for that alone, I thank you for helping me with that. And I'm hoping for more improvements. Because I'm always looking for relief, and I think a lot of us MSers are always looking for some kind of relief because we do have pain, we do have neuropathy, we do have and if there's some way of getting relief, I'm all for it. And if Gonstead is a little bit of an answer for that, then I'm all for getting that word out to people.
Yeah, I think there are some good chiropractors that don't do Gonstead. They're just really hard to find. So start if you're in your hometown. Look for a person. My mom down in Florida. She lives down in Florida. She has to travel 45 minutes up towards Orlando. She lives in Lakeland to go to her Gonstead specialist.
Yeah.
And she's 88 years old.
Yeah.
We treat babies. We treat, just about everybody who could have nerve interference.
Yeah.
And if the birth trauma can be a huge thing.
Yeah.
But again, we're not treating symptoms. We're treating nerve interference caused by these vertebral subluxation complexes. And I think a lot of people could benefit from that.
Yeah.
But MS people, the sooner they get in to see a specialist for this, I think if you give it about 6 weeks, I'd be surprised if you didn't see a difference.
Yeah, some kind of relief. Yeah, I agree. I'm walking around. And Doc, you're not paying me to promote this. I'm living proof that I'm getting relief from getting adjustments. No doubt about it. There's nothing wrong with at least trying it too. You try it, and if you get something out of it, great. If you don't, then at least you tried it. And I'm all for trying anything to get relief from MS or any kind of chronic pain you have.
Well, Brian, I so much appreciate the opportunity to be on your podcast. You're doing a great job with helping people with a horrible disease that not only affects you, but it affects your family and your loved ones. And, trying to restore as much function as we can and really help you reach your optimum ability to heal yourself is what we're about. And, I look forward to the next year. This year you may find more improvement this year than you did last year. I'm hoping for that. And I hope that we can make a difference for other people across the country who are listening to your podcast and may look up a Gonstead chiropractor in their community and give it a shot.
Yeah, I absolutely, Doc. I really appreciate you coming on the podcast, sharing your expertise about chiropractic, and I would love to have you on again. Just to discuss anything else that we can come up with, just to help people out. I'm all for helping people, and I really appreciate you coming on today.
Well, thank you so much for having me, Brian.
Yeah. All right, this is MS Michigan Man. I am going to get ready to get out of here. Please remember to follow and subscribe to the podcast. If you have any questions for me or for Dr. Haely, you can put them in the comments section. I will get a hold of Doc, ask him any questions you have, and get an answer out to you. And I appreciate everybody for listening, and I will talk to you the next time on MS Michigan Man 64. I'm out.